We just finished the Monday meeting of the White House Coronavirus Task Force. Since the time the President established the task force here at the White House, it has literally met daily, and we continued that effort today. We added the head of the Center for Medicaid and Medicare Services, Seema Verma, to the task force today, as well as Robert Wilkie with the VA. First, a few basic facts and reports, and then we'll hear from other members of the task force about ongoing efforts. At the present moment, we have 43 domestic cases of the coronavirus, 48 cases of individuals who have returned to the United States. Of the domestic cases, 29 of the 43 are either in California or Washington State. And we have communities that are facing what the experts tell us could potentially be a cluster in those communities. Sadly, today, there were 4 additional fatalities, raising the number that 6 Americans have lost their life to the coronavirus. And on behalf of the President and all of the American people, we extend our deepest condolences and sympathies to the families of those that were lost. Despite today's sad news, let's be clear, the risk to the American people of the coronavirus remains low, according to all of the experts that we're working with across the government. And as the President has said, we're ready for anything, but this is an all-hands-on-deck effort. Today's activity really reflects the President's effort to bring the best minds of private industry together, the best leadership from around the country at every level. We had a good meeting this morning with governors from 50 states and 3 territories. I was able to convey to them the gratitude that the President and our entire administration feels, particularly for governors that are dealing with the coronavirus in their states, those that have taken repatriated personnel. I can say that what I hear from the nation's governors is that there has been a seamless relationship between all the agencies of the federal government and states thus far, and we're encouraged to hear that. But I told them that we are committed to a full partnership with state governments and to their health officials and to local health care providers going forward. We also met today with some of the leaders of the top pharmaceutical companies in the country. The President spoke to them not just about vaccines, which many of the companies are already beginning to work on, but just as importantly, the development of therapeutics. And it is remarkable to think that there may well be a vaccine going to clinical trials within the next 6 weeks. The nature of trials, as the experts have explained to us, is that the vaccine might yet not be available till late this year or early next, but the therapeutics giving relief to people that contract the coronavirus could literally be available by this summer or early fall. The most encouraging news from that meeting was that our pharmaceutical companies, which are recognized as the greatest in the world, all have already formed a consortium to work together to share information in the development of therapeutics and vaccines. A quick update. Yesterday, we were fully implementing the new travel advisories for portions of Italy and South Korea, and the implementation of screening of personnel from across those countries who are trying to take a direct flight to the United States of America. I was pleased in the White House Task Force meeting today to learn that within the next 12 hours, there will be 100% screening, all direct flights at all airports across Italy and across South Korea. The President has directed us to bring the full resources of the federal government and to bring the very best minds in this country to bear on this effort. And finally, today, I'm pleased to welcome to our White House team a world-renowned global health official and a physician. She will be my right arm through this effort, as the President has tasked me to lead the White House response to the coronavirus. And I'm grateful that Ambassador Deborah Birx, also Dr. Deborah Birx, will be on our team. And even on her first day, she's already been contributing significantly to our discussions. Dr. Birx serves as the U.S. government's leader today for combating HIV/AIDS globally and has developed an international reputation as that. She's a scientist, a physician, someone with 3 decades of public health expertise, including virulent diseases, vaccines, and has vast experience in interagency coordination. Dr. Birx and I have talked about the importance of bringing all of these various entities together to bring about President Trump's vision for a whole-of-government response to the coronavirus. So with that, I'd like to recognize Dr. Deborah Birx for a few introductory and welcome remarks, and thank you for stepping up one more time to serve our country.
Thank you. Thank you, Mr. Vice President. It's a pleasure to be here. I just arrived from South Africa last night. Everybody took great care of me. I had computer and phone in record time. It really shows the level of efficiency and expertise here to really get moving quickly. It's clear that the early work of the president, both with travel restrictions and the ability to quarantine, has bought us this time and space to have this task force be very effective. I have never worked with such incredible scientists and thoughtful policy leaders, and I got to spend the day with them. I'm trying to get up to speed as fast as possible, and I look forward to the days ahead of really working together to end this epidemic. Thank you.
Great. Secretary Azar?
Well, thank you, Mr. Vice President. I just want to first start out by saying how delighted we are that Ambassador Birx is going to be leading, coordinating these efforts across the government. Dr. Birx and I go way back. Dr. Birx and basically every leader at the Department of Health and Human Services go way back together. So we already have established relationships, and maybe not too way back, right? We already have very established, productive working relationships that I think are going to keep the interagency process working incredibly smoothly. And as the Vice President said, Dr. Birx already has been asking the right questions and challenging us on all the right scientific and policy matters that we need to focus on. I just want to begin by recapping the current situation that we face with COVID-19. As the Vice President mentioned, as of this morning, we have 43 confirmed or presumptive cases of the virus in the United States, excluding our repatriated cases. 17 of those cases are travel-related in one way or another. 26 are believed to be person-to-person spread. Because of the President's strong leadership and all of the hard work that our public health professionals have done at the local, the state, the federal level, the immediate risk to any individual American has been and does continue to be low. But the risk for people with possible exposure to identified cases can be high. What every one of our experts and leaders have been saying for more than a month now remains true. The degree of risk has the potential to change quickly, especially if we see sustained spread of the disease around the world, which could qualify this disease as a pandemic. As Dr. Fauci said this morning, we will see more cases of community spread in the United States. As we've emphasized for some time now, we all need to prepare for the potential need. Prepare for the worst, hope for the best. In some places, we will have to use the range of our mitigation efforts. In fact, we already are working closely with Santa Clara County and the state of Washington, in particular King County, to assist them in thinking through some of the best practices from our pandemic action plan, as well as learnings from Singapore and Hong Kong around the most effective community mitigation efforts, such as temporary school closures or even more titrated responses Dr. Schuchat has talked to you about, such as having school, but perhaps not having assemblies in school. That's why the President has taken an unprecedented whole-of-government approach to protecting the American people, including the steps in the last few days to radically expand and improve the testing that we have and to improve access to respirators needed by healthcare workers.